Turning our attention now to the ASX, here's Matt Birney and Bulls and Bears with the latest public company views and interviews.
Welcome to Bulls and Bears, where we break down the latest ASX announcements from public companies that are doing interesting things. Today's Bulls and Bears report is brought to you by Singular Health, ASX code SHG. I'm Matt Birney and I'm joined now on 6PR by the Managing Director of Singular Health, Tom Henley. Hi, Tom.
Hi, Matt.
Singular Health is set to list on the ASX on Friday, February the 12th, bringing with it some disruptive software that looks set to revolutionise how patients and doctors view their CT and MRI scans. Singular's software takes multiple hard-to-read two-dimensional images from a patient's CT or MRI scan and presents them as one coherent and easy-to-recognise 3D model of a problem area. Firstly, Tom, what's the problem with a standard two-dimensional CT or MRI scan?
With a 2D MRI or CT scan, essentially, as you mentioned before, as you enter that big machine and you're lying there, the machine is taking multiple images, multiple slices of your body, and then presents them all in two dimensions. And so it takes a radiologist with many years' experience to look through those two-dimensional images and understand what's happening inside that human body. And whether that's an issue with your lung or a tumour that's presented somewhere or a whole sort of range of different pathologies, being able to interpret that, even as a surgeon or particularly as a patient, is very difficult. And that's why radiologists are required to sort of step in and interpret these two-dimensional slices.
Okay, so how does your software solve that problem?
So our software is a volume rendering platform, and we take those two-dimensional slices, sometimes dozens and even up to hundreds of slices, and joins them together in a way that creates a perfect representation in 3D of what you're looking at in those two-dimensional slices. And you've got to remember, we're talking about millions of points of data that is then combined to make this perfect 3D image that you can either view on a computer or through virtual reality, step inside that and have the complete fly-through effect. So instead of looking at a slice of a kidney relative to a slice of a lung and a slice of a heart, you can actually look at the entire kidney and go into that kidney or go through the spinal column or go down the trachea. I mean, it's quite an amazing experience when all of a sudden you combine that information into the 3D and VR experience.
Okay, who's going to use it and how are you going to make money from it?
It's currently used by surgeons for surgical planning. We have TGA approval. We currently have a free version of what we call our 3-DICOM viewer on our website. It enables patients to upload their CT and MRI scans. So we'll make money from this because we sell the software as a virtual reality MedVR software at $300 a month as a subscription service, or as $5 a month for a pro service in 3D only, and $30 a month for a surgical application in 3D only.
Tom Henley from Singular Health, thanks very much for joining me on 6PR today. And remember, Bulls and Bears is only here to give you information, not advice, which you should of course seek independently. I'm Matt Birney. Thanks for listening to Bulls and Bears.
For more public company CEO interviews, go to the Money page at 6pr.com.au and click the Public Companies tab.